Ayesha Anwar. Today we're going to be packing and irrigating an abdominal wound. So I've reviewed my physician's orders and I've collected all my supplies, and I'm going to enter the patient's room. So I'm going to make sure I do my entrance safety check. And hi, my name is Ayesha Anwar. I'm going to be your student nurse today. I'm going to be irrigating and changing and packing abdominal wound dressing. I'm just going to verify I have the right patient, and I'm going to ask them to verify their name and their date of birth. Okay, and then I've already provided my patient with analgesics beforehand, so we're good to go. I'm just going to bring everything up to my waist height to maintain sterility. Ideally, I would do that, but I'm just going to have to do this because it's an at-home demo. So I've already verified my patient, I've collected all my supplies, I've verified the physician's order. Now I can go ahead and start establishing my field. So grabbing everything by the 1-inch border to make sure I maintain sterility. Okay, I don't need this, so I can throw this out. And I don't need this either because there's a garbage bag by the patient's bedside. Okay, so I'm just going to bring everything, just move stuff around in my boat to make sure that I have enough space in my field. And everything's within the 1-inch border, so I don't have to worry about contamination because everything's within the sterility. So now I'm going to go ahead and start placing my supplies in the field. So first I'm going to grab my cannula. This would be unopened, but for the purpose of the demo, I'm reusing some old supplies. And then my scissors, this would be opened as well. For the purpose of the demo, I'm using some old supplies. And then for my 30cc syringe is what I put in there right now. And then next I'm going to grab my Q-tips for packing and measuring. So these would ideally be opened as well. And I'm going to grab some extras in case. And then this would also be in a sterile packaging, so I would pull that out with my forceps. So I'm just going to do that and place it in here. And then I'm going to add my normal saline, so make sure I don't splash anything. And I forgot to mention, I would be doing more hand hygiene over time as I go through the demo. So I'm just going to do my hand hygiene now, and I'm going to put on my gloves to take off my patient's old wound dressing. So I have my gloves. I'm just going to go ahead and remove my Mefix and my two 4x4s and assess for any drainage. So it looks like about 30% serous drainage. I'll make sure I make a note of that in the IPN. I can throw this out. And then I'm going to grab the inner packing. So it looks like about 70% serous drainage. I'm going to make sure I put that in my IPN as well. So I've taken off the wound dressing. I've put all my supplies in there. So I'm just going to assess the wound a little bit to make sure. So it looks like granulation tissue, and there's no sloughing or anything, but I'll do the measurements after I'll do the proper assessment and measurement after I'm done cleaning the wound. So I'm going to remove my gloves and just do my hand hygiene. And then I'm just going to go ahead and put on my sterile gloves. So this would originally be in an unopened packaging, but since I'm reusing old supplies, they've already been opened. So I'm just going to go with that. so I've put on my sterile gloves. Now I'm going to go ahead and start and just drop some fluid. Oh, so this fell. It was within the 1-inch border, so it's not contaminated. So I'm just going to fill up my syringe with 15 cc of normal saline. Normally I'd be using 30 cc, but for the purpose of the demo, I'm going to use 15. And just put on my cannula. And then I'm going to start irrigating from cleanest to dirtiest. So I'm going to start in the middle and just irrigate until the drainage runs clear. Okay, so it looks clear. I'm satisfied. I can throw out my syringe. And then I'm going to grab my sterile forceps and just to soak up the excess normal saline. So I'm going to fold it in half and just dip it into the wound to soak up any excess normal saline. And I'll make sure I don't touch the wound bed or move the 4x4 around in the wound. So I'm just going to let it sit for a bit and soak it up. And it creates a little buffer between the forceps and the wound bed so that the forceps don't get dirty. So next I'm going to grab my 2x2 and just make a rosette and clean the peri-wound area, so dip it in normal saline. And then clean the far side, so one swipe, top to bottom, done. And then I'm going to do the same with the near side, so make a rosette again, and dip it in normal saline. Okay, and one swipe, top to bottom, done. And I'm going to dry in the same manner. So 2x2, one rosette, and one swipe top to bottom, done. And then the near side, one more time. One swipe, top to bottom, and done. Okay, so I have cleaned and packed my wound, and I've cleaned my wound. So I'm just gonna go ahead and assess it. So it's 100% granulation tissue. There's no sign of any infection. Wound edges are intact, and it doesn't look like there's any undermining or tunneling or anything. So it looks like healthy healing tissue. So now I'm gonna go ahead and grab my sterile Q-tip and just check for undermining or tunneling on one side of the wound. So one swipe. Okay, so there's no tunneling or undermining. I can throw this out, and I'll grab my other one. So sure there's no tunneling or undermining on the other side, and there isn't, so I can throw this out as well. And then I'm just going to measure the depth of the wound. So it looks about 2 centimeters, and then measure the width. It looks about 4 centimeters, and measure the length. So it looks about 12 centimeters. Okay, so I'll make a note of all of that in my IPN, and I'll make a note of all my measurements and what the wound state look like, so I can go ahead and do that after. So now I can just get started on my packing. So first I'm going to grab my Curlix and just take some out. And then grab my scissors. And cut. Okay. And then I'll just dip this in normal saline and make sure I wring out any excess without splashing onto the sterile field. Okay, so we've done that, and I can go ahead and start packing with the help of my my Q-tip. So I'm gonna pack from the corners and just make sure all the area is covered properly. And I'll just make sure that my my Curlix doesn't touch outside the wound, peri-wound area, besides the place that I've cleaned in. So okay. So I've packed the wound. I'm just gonna grab my scissors. Cut off the excess. And then I'm gonna grab my forceps and just pack the part that was cut off, and make sure that it stays within. Okay. So I've done that. Now I'm just gonna grab my 2 4x4s and just place it on top of the wound. Okay, done that. And then I'm gonna grab my Meafix and just place this on top of the wound. So I'll go this way. And my hands at this point can be considered clean, not sterile, so I can touch the outside of the wound. And just make sure I maintain sterility when I'm packing, or when I'm placing it. Okay. And then I'll grab the last one. And make sure there's no, it's occluded properly, so that there's no way for like bacteria or microorganisms to get in there. Okay, so I've packed my wound and I've done all my process, so now I'm just going to clean up by the bedside. And before I go, I'm going to do my entrance exit safety check, lower the patient to the ground, call bell, put the call bell in their reach, and make sure the patient's okay. So I'll put in my IPN the procedure that took place, so how much drainage there was in the wound, and the wound measurements, and what the wound looked like. So if there was no sign of infection, it was healthy granulation tissue. I'll also put how well I handled the procedure, so that the patient, and how well the patient handled the procedure, and I'll put in the IPN the packing that I used, acrylics, 2 4x4s with Meafix covered. So I'm just going to make sure I put all that in the IPN, and we're done.